we're going to update both you and the community on where we are in reentry planning. Just for anybody who's listening in, tomorrow we are going to take this portion of the board meeting and put it into a condensed format so that our public can view it without watching the entire board meeting. And also to the bunches and bunches of emails that I'm getting, I am reading them all, don't always have a chance to respond to them quickly. And but I'm trying to get some responses. So my latest one was, tune in for some of our information tonight. We have been kind of well, I don't even know the word, frantically planning and thinking about how do we get kids back in person. We have been doing that since the beginning, but as our metrics were high, we shifted our focus to get really good at CDL and limited in person. So we've had a variety of meetings and have met almost every day over even winter break to really begin figuring out the pieces and how we move back in. So with that, I'm going to turn it over to Dr. Sproles and Dr. Odosnata, who are going to share with you an update on where we are. As we're calling up the screen, we did just, I think, got a press release during this meeting that the governor has said we'll move into vaccinating age 65 and older, and educators in the next round. They're hoping for more vaccinations from the federal government. I think in her press release that I've not fully vetted yet, I think it said starting about the 3rd or 4th week in January. So I also believe that's really good news for us. So with that, I'll turn it over to our 2 assistant superintendents.
Thank you, Superintendent Perry and Board Chair Chandragiri and board members. And I just want, as all of you, I think, have given a lot of accolades to the students who just presented. I think it's important, and I really appreciate having the students' voice in this, because the reason why we are moving towards an in-person model is because of those voices. So I'm going to take the first 4 or 5 slides or so, and then Dr. Udosonata will back clean up and finish up. So on December 23rd, right before Christmas, Governor Brown sent a letter to the Oregon Department of Education and Oregon Health Authority expressing her gratitude for the resiliency of our Oregon educators, our students and families. And she also articulated a hope that we would be able to be back for in-person instruction as soon as February 15th. She identified the elementary level as the starting point, the launch point, to be able to make that happen. And all of you know, who have been following this conversation, a focus on early elementary and early learning has been something that we've been focused on as a district from the start. The reason for that is some of the gaps that happen in early elementary are ones that are really hard to get over with a digital learning experience. If you can't read and you don't have someone to sit next to you to help you navigate a computer, it's hard to learn to read on the computer. So that's why that focus is there. The governor also said that she was localizing decision-making. So up to this point, the metrics have been largely sent out through OHA, and they have governed how and when districts can begin planning for in-person. And she made the COVID metrics advisory at the county level. And that was a really big decision and a really important decision. And what that basically means for us is that we need to move to work really closely with our 2 public health authorities, Marion County and Polk County, to be able to guide decisions. And I have some good news about that, because we've been working collaboratively with them for several months and have a very strong relationship with them. We've been working closely with Marion and Polk. We've also been working closely with Salem Health, and Salem Health is one of the providers of vaccines, and to be able to have access to vaccines working through local hospital systems. They are working hard to develop an educator vaccination schedule. As Superintendent Perry alluded to, I think it was about halfway through our board meeting, I got 4 or 5 text messages, 2 of them from other assistant superintendents around the state, saying that we finally have a date for when we could start possibly vaccinating educators. I don't want us to be too firm on that date because the caveat, I believe, is that the federal government needs to release a reserve of vaccinations to make that happen. And that's something that's outside of our control. So in the meantime, we know that educators are not in 1A, which is the very first group of people vaccinated, but we're kind of at the top of the list of 1B. We do have some good news that we have some nurses, some OT, occupational therapists, physical therapists, who were actually categorized as 1A, and they received their vaccinations last week. So we do have some employees who have started that process. So the localized decision-making, what this looks like is a collaborative and ongoing relationship with Marion and Polk. So we've been meeting weekly with them, including Superintendent Perry, commissioners from Marion County, health officials from Marion and Polk as well, to be able to create a relationship where we can make decisions about moving forward with in-person instruction at a county and a district by district and even a school by school level. Up to this point, we have been making county-wide decisions for entire swaths of schools that the school may have deep impacts from COVID or may not, and when you're a part of a large county-wide decision-making structure. So part of the reason why Marion and Polk have been such strong partners with us is because our district and our school personnel have demonstrated that they can follow the safety guidelines. And I can't reiterate that enough, that the blueprints that we've set out and the protocols that we've established, even with vaccines, have to be followed very, very closely to prevent the spread of COVID. The CDC and a lot of national studies have shown that schools are not known to be super spreaders. Our own localized data shows that as well. We've had up to 7,000 students in our school in any given week. And even with that number of students interacting in schools, if we follow our safety protocols, which are the things we've known all along, facial coverings, frequent hand washing, 6 feet between people, reducing large gatherings, and strong tracing protocols, as well as strong vetting protocols when people come to the environment. If we follow all of those things, schools are actually much more stringent than other places in our community. I think when I go to Winco, I don't necessarily stay 6 feet from the person who's walking up on me and is maybe wearing their mask covering their face and maybe hasn't. And I don't know if they've gone through screening protocols or not. So our schools actually have a much higher protocol level than most other places in our community. The third thing is that we need strong interagency alignment. And so ODE is putting out a new Ready School Safe Learner guidance next Tuesday, or before, maybe it'll be before. And so we'll bring updates for you for that. Part of the difficulty right now is that we're straddling guidance from the Early Learning Division, from ODE, from OSAA, which Ethan will talk about that a little bit. And they each have slightly different ways that they make decisions and how they guide kids at school. So some alignment was called for in the governor's letter, and we hope to see that as well. So here's the guidance for getting our kids back in school. And this is guidance that we've gotten from Marion and Polk, as well as guidance in relationship to what we've heard from the governor. Like I said before, we have to adhere even more strictly to our blueprints. And what this means is when we bring back students, we have to cohort students really tightly. We need to follow all of our physical distancing, our facial coverings, our 35 square feet, per person in a space. All of those things still need to be followed. Marion County strongly recommends that we follow an incremental reentry model, which means we don't just say we're bringing back all K-8 students all in 1 week. They highly recommend, and we're going to follow this recommendation, that we bring in targeted grade levels. So we're thinking about starting with kindergarten, maybe kindergarten and first, and then K1, 2, K1, 2, 3, incrementally adding. And what that allows us to do is stabilize and show that we can follow our protocols with one group before we add the next group, before we add the next group. So it's a way for us to bring students back in, prioritizing our youngest learners, and stabilizing as we do it. So just as a, for those of you who remember what we were talking about back in August, this is kind of a throwback to the hybrid model that we first discussed in August. And I think it's important for people to realize when we say bringing students in for in-person instruction, that's still a hybrid model. So they'll still have a digital learning component. The reason for that is our schools don't have learning spaces to keep kids far enough apart from each other to meet the guidelines and to be able to be safe if we brought all kids in every day. So just the necessity to break up the number of students in any one classroom means that we need to have an A day and a B day cohort. So the way that it would work for our students at Salem-Keizer is Mondays would still be our student support day. And so that's a day for our teachers to do planning and preparation. That's a day for teachers to work out times to reach out to students and families who may be struggling to connect or maybe struggling through the process. And it's also a day for our teachers to prepare for the week ahead. Then on Tuesday, if you're a Tuesday, Thursday family, your student would attend in person on Tuesday. And then on Wednesday, they would stay at home and continue learning digitally, come back to school on Thursday, and then stay at home and learn digitally again on Friday. So that would be a Tuesday, Thursday sequence, or it could be a Monday, Friday sequence, depending on which cohort you come in contact with.
Right.
The key idea behind this type of cohorting is that if we have some positive cases, which I just think we need to understand we will have cases that are in the community that get brought into our schools. That is something that will happen. When that happens, we'll work closely with Marion and Polk to isolate the cases, trace them down using their contact tracing, and we may have to pull out cohorts of students who would go back to learning at home while we conduct our investigation and make sure that it's safe to come back in school. So we're hoping to do targeted cohorts. That's the advantage of the cohort, that if you have a few people who test positive, you don't have to shut down an entire school. So that's one of the reasons why we do the A day, B day.
Great.
Yeah, Director Kylo.
You want me to wait?
Can you repeat that?
May I ask a question, or would you like me to wait?
My slides will probably take about 5 minutes tops, and then I think that'd probably be a good time to ask questions.
That's just fine. Just
Perfect.
that.
And
Dr. Sproles?
I think, is that my last one?
That's your last one. Then I have 3 or 4 slides.
Okay.
Yep. So I want to expand on what Dr. Sproles is talking about in terms of our plans for bringing students back in person. One thing that's a requirement for us from ODE as part of our Ready School Safe Learners blueprint is to solicit feedback from the community. And so what you see on the slide is how we're breaking down our different target groups for soliciting feedback. And we have a different strategy for each group. So we have our educators. In the summertime, we went through a process of getting feedback from these groups, but we did it a little bit differently. And we learned from the input that we got during the summer for what works best. So at the school level, what we'll do this time around is we will solicit feedback from educators at the site level. So that will be ran at the school level, while we're still going to continue to collaborate with our associations, and that's SKEA and ASK-ESP. That's our licensed and classified associations. And we're already in conversations with them about best strategies and practices for bringing students back. And remember, that also includes bringing staff members back who haven't been on campus for a while. Additionally, we're going to solicit student voice. So we'll be working, I think Cynthia Richardson, Director Richardson, is already developing a multitude of strategies, starting first with feedback surveys from students to try to learn more about what student needs are for coming back, especially since students have been out of school since March of last year. And importantly, we want to get input from our community. And so we will be holding a series of town halls. And in those town halls, what we'll do is we want to maximize our communication, which I'll speak about a little bit on our next slide, to make sure that all community members know the details about how we plan to bring students back safely. but we will also want to give an opportunity for parents and community members to ask questions and also provide input that we'll bring back to our planning teams as we move forward with bringing students back to in-person learning. Now, this slide just shows a lot of considerations that we need to take into account when we start planning for bringing students back. A lot of these bullet points are included in our Ready School Safe Learners, but we showed this slide to show that there's a lot of moving parts here. And what we'll do is rely closely on our blueprints to answer a lot of these questions. But I want to call your attention to the 5th bullet and the 2nd bullet. The 5th bullet's the Ready School Safe Learners guidance for January. And that's going to really be an indicator for how we can make decisions around planning. And the 2nd bullet is that decision-making as advisor, or the metric is no longer a state mandated metric. It's an advisory metric that Dr. Sproles mentioned earlier, that we will be working closely from an interagency standpoint with our local health authorities to make decisions about how to plan best for bringing students back. At the same time, we have a lot of these other bullets that we don't want to lose sight of when we start the planning process. So we're going to be working closely with our operations team. They meet at least twice a week to give briefings on where we're at with a lot of these considerations. And we do know that we're going to have to do some problem solving when it comes to things like making sure that we have enough substitutes when we do bring students back, making sure that we're meeting all service levels. That's why you see continuity of food distribution. So again, there's a lot of things to take into consideration, but I do want you to know that between our operations team and our cabinet members and our building principals, we are doing our best to have our best thinking and creative thinking at the table right now to make sure that we bring students back safely. So our next steps is to communicate, right? So we need to work to the greatest extent possible to communicate to the greater school community. And so we'll work closely with our communications department. And we're also going to need to work really closely with our building leaders to make sure we're disseminating accurate information. But since information is changing quickly, as we've seen throughout the course of this board meeting, we want to make sure that we have the best platforms to update families, staff, the board, and the greater community. So whether that's the use of our school website, press releases, or disseminating information through in board meetings. Again, we're going to have another board session next week on the 19th. We want to make sure that we're doing our best to be efficient and effective with our communications. Also, we need to update our blueprints. And so we're always working to make sure that our blueprints are updated, but we know that we're going to get additional guidance and that we want to be from the Oregon Department of Education. We want to make sure that we're in a space where we could look at the updated guidance and compare it to what we already have in place. Importantly, staff members who have not been on campus for a long time, we want to make sure that we give them enough time to become familiar with all the safety guidances and protocols that we have. So I want to skip to slide 4 and then go back to, or not slide 4, bullet 4, and then go back to bullet 3. So our next focus is, and we're already working on this now, is to prepare for bringing back elementary students. As Dr. Sproles mentioned, the priority right now is to bring back our youngest learners. And so those are the learners that will be kindergarten, first grade, second grade are the ones that we'll be focusing on bringing back incrementally. And we want to make sure that the staff members and the leadership at elementary schools do their due diligence to review the blueprints. And we highlight sections 1 through 3, and that's the public health and protocols guidance, that's the facilities and operations guidance, and the response to outbreak guidance. And bullet 5 of the blueprint is the instructional guidance, keeping in mind that our educators who've done such a good job in CDL are going to have to continue to navigate the world of possibly pivoting from being in-person instruction to maybe going back to CDL, since they will have students 2 days a week, and then the students will be learning from home 2 to 3 days a week as well. For our secondary, what we really want to focus on is continuing to emphasize limited in-person instruction. We want to expand limited in-person instruction, knowing that the soonest that we can bring our middle and high schoolers back would be later on in the spring. So those are our next steps. And finally, I want to close by giving you OSAA updates. This actually changed today, and we prepared this presentation before we got that update. So I just recently updated this slide right before the board meeting started. But here's what you need to know. We're really pleased that we brought students back for workouts on this week, last week, January 4th. And so as you recall, right around the Thanksgiving break was when we had to put a halt to season 1 workouts. And remember, season 1 is for almost all sports that can be working out under OSAA and county guidance to be working out. So those sports and activities have resumed. And remember, all activities are to be facilitated outdoors, and our coaches are doing their best to make sure that they're following all protocols and really limiting any outbreaks or potential for outbreaks. Season 2 will start in February. Season 2 will be our fall sports. They'll start in February for what is scheduled to be a 6-week season. And do know that at this time, football remains to be prohibited as a full contact sport. And the reason for that is the OSAA guidance shows that, or gives guidance that all full contact sports, so that's football, basketball, wrestling, and cheer, are prohibited from participating in competition, but they can still participate in conditioning and workouts. So we will have updated guidance from the OSAA next week, and it's a possibility that football could be postponed for a later date, maybe moved to season 3, which will start in March. So we'll keep you posted. We'll have more information for you in January on January 19th. And that's it for our report.
Okay. Craig,
Go ahead. Director
Yes,
Kyler.
Director Kylo.
can we go back to the presentation?
Give me just a moment. Which slide would you want me to go on, Director Kylo?
The one where I asked the question, so it was just before your presentation.
Yep, no problem.
There we go. Craig,
Yes.
my question is the same one I had earlier, and I don't remember the answer. So if I were, let's say, heaven forbid, an English instructor. No, let's say I'm a 4th grade teacher, and I would have had a class of 30. So on an A day now, I would have 15 in class
Yep.
and 15 at home.
Yep.
So I'm responsible on an A day for teaching in person and doing computer lessons.
Partially. And so,
Okay, help me understand partially.
yeah. And the partially, so the answer is yes.
Okay.
I guess the
That's what I
first answer is
understood.
yes. And then let me explain how that might work.
Okay.
So we're going to have synchronous and asynchronous learning days, just like we do currently when kids would log in.
Okay.
We're also thinking about, and a lot of these are just kind of initial ideas. And so I don't want us wedded to them, but our initial thinking is we could run some of our socio-emotional learning groups. We could run music and PE, library touch points on the off day. So that would be a time or we could run things like reading interventions or math interventions for students who need small group support and might be able to have a contact with a classified assistant on the day when,
Okay.
let's say I have my A day group in, and then the B day group would be going through those activities at that same time.
Okay, that was going to lead to you answered my next question is under that scenario, would we then need to be adding more staff?
Yeah, good question. And we're running those scenarios right now. Good question.
With 2 separate groupings like that, that's kind of what it sounds like.
Yeah, we very
that's-
well might need to do that to add
That-
some to be able to run it. The one thing that is hard that we just need to remember is that we also have the EDGE program up and running right now,
Right,
which is a chunk of our students.
right, okay.
Yeah.
Will Edge continue or will it go away if we go back to this model?
No, EDGE, we hope EDGE will continue far into the future. I think it's serving a need, and we've demonstrated that some kids really thrive in this environment, and we haven't really been able to meet their needs yet. So we've set up EDGE to be an environment that would continue in the future.
Okay,
And that's part of what we're going to reach out to our educators. SKPS is doing a elementary forum on Thursday. And part of what we're going to talk to them about is to really do some thinking around that. What do you do on the synchronous days and what do you do on the asynchronous days as well?
okay.
I have a couple questions.
Okay.
I had one.
Yeah, so Director Hein first, and then we'll go to Director Goss.
So I have three and they're not all long, so don't worry. So you've got A days is Tuesday and Thursday, B days is Wednesday and Friday. I don't know why, but there's something in my gut that says, isn't it safer to have a Monday, Tuesday, A day, a Wednesday, really clean it up day and teacher prep day, and Thursday, Friday, B day, so that there is a nice big gap between students coming and going in the case of an outbreak. And I'm asking my other two questions and then you can figure out how you want to answer those. How many are in the EDGE program? I don't remember. And also, maybe I just didn't see it. How are we addressing the CTE students? They really need hands-on in school, just as much as the kindergartners. And some of these kids, this is their last opportunity before they graduate. We really have to get these kids in school. So those are my three questions.
So you really had 4 questions, Director Hein. I think
Did I? Sorry.
I think I can answer the first 2, and maybe Dr. Dosanata can take the what are we doing for CTE and what are we doing for possibly credit to be able to make sure that seniors are on track. So Director Hein, the first question around why Tuesday, Thursday, and Wednesday, Friday, and I think we all remember in the summer, we explored lots of different models using groups of educators to come together and put their best thinking on what we think would be most successful. We also looked at an AM, PM, like half the kids in the AM, half the kids in the PM. And those are all different configurations at different districts. Eugene is doing 1 week on, 1 week off. So there's lots of different ways that people are addressing this. Our elementary educators in particular felt that a Tuesday, Thursday, Wednesday, Friday model decreases the number of days or the gaps that a kid has to overcome when they get back into the classroom. So for instance, if we had a Monday, Tuesday, Thursday, Friday model, the students that were with their teachers on Tuesday, that's 5 long days in the life of a kindergartner before they come back on Monday. And those of you who have taught kinders know it's like it's like winter break every Monday then when you bring kids back. It's such a long gap. So our educators wanted more frequent touch points, and that's why we went with the Monday, Wednesday, Tuesday, Thursday, with cleaning on Monday, deeper cleaning on Monday. The other thing I would add with that is,
can I ask a question about that then though? If they're going to be doing something online on the other days, with the exception, I'm assuming, of Monday, the current teacher time day, then it really isn't 5 days. It's just 5 days that aren't in person. There still is 2 other days of education, whether it's library or different things you were talking about. So it's not really 5 days.
yeah, I think that's exactly right, Marty. And I think that we've learned more about how to make that how to make that valuable time. One thing that our teachers really like the idea of is on a Tuesday, introducing new content, getting kids started on that content, and then they go home on Wednesday and they work on that content, then they bring it back on Thursday. And so, and then they work together again, and then the teacher would launch them off for their Friday work. And so that sequence as well is a pattern that teachers liked better than having kids 2 days and then not having them for 5 days. But honestly, there's pros and cons about each of the models. And this is just the one we settled on because we thought that we heard from our educators that it would be the best bang for the buck. And I lost your second question, Director High, I remember the two for Ethan. I can't remember.
Well, somehow I got 4, and I'm not sure how, but I was asking how many were in Edge,
Oh,
and and the other was the CTE program and how critical it is to get our kids back into CTE in person.
okay, thank you. So for the number of students in Edge, I think and I can come out with an exact number for you, Director Hyen. It fluctuates a little bit, and I think it's important to remember we had an open enrollment window again in Edge in November and December, and we had some families migrate from Edge to CDL, to school-based learning, and some families migrate back to Edge from CDL at that time. But I think, and Superintendent Perry, is 6,300 the number that I'm in the ballpark with?
That's the number I'm thinking.
Okay, so it's around 6,300, but Director Hyen, I can come with a specific number next week.
No, ballpark was fine. Thank you,
Okay.
Craig.
Director Goss, we need to kind of get moving because we're
Okay,
They had one more question they needed to answer.
I'll be very brief and to the point with the following 2 questions that Director Hyen asked. First, I want to just share that we have a lot of dynamic instruction occurring from our CTE teachers and CDL. The things that they've been capable of doing in comprehensive distance learning has been impressive. But to answer your question, one of the benefits of the secondary schools not going first in bringing students back is we have the opportunity to plan and strategize for how we can better serve students in CDL. And so that also includes what are ways that we can help to support our staff, our students who need the hands-on from career technical education courses. And so do know that those conversations are happening while we don't have an answer yet for bringing them in. What I do want you to know is we do intend to expand LIPI when we can. Remember, we start to maximize LIPI and our limited in-person instruction in November, and then we had to scale way back. Now we're going to have conversations again about how we can bring kids in, and career and technical education students are ones that we're thinking about too when we're having those conversations. Additionally, how will we support seniors? I want you to know that today I actually spoke with 3 high school principals about what we're doing for our struggling seniors. And you'd be pleased to know that at least from the high school principals that I spoke with today, that not as many seniors were in jeopardy of not graduating as we might think, given how things went first quarter for students in comprehensive distance learning. But to that end, all of our principals have a plan for how to support students who are struggling. And our first go-to is to make direct contact with families for students, we'll say seniors who have 21 credits or less, or who are showing patterns of not passing, and bringing them in for limited in-person instruction, or finding out what's happening with them and try to do our best to provide supports, whether that's using a community outreach specialist to network with that family to make sure they have their needs. But for now, do know that our principals are giving a lot of attention to that, and we're confident that we're going to get most of our kids across the finish line.
I have a quick question, or maybe Vice Chair Bethel can go first, and then I'll go after that out of respect.
I'm pretty sure Director Goss was before me.
Okay, then let's go to Director Goss then. And then.
Thank you, Danielle. So I spent a lot of time in a very controversial program that we did at Hayesville years ago. And it took a lot of coordination, but I think we could do some of that now and more effectively use the space we have. So if we have a cafeteria, if we have a multi-purpose room, any of those places can hold larger groups of people. And then in smaller areas, such as up on the stage we had them, or in the hall sometimes, we had not certified teachers, but we had teachers that could handle mathematics just fine in elementary. And it seemed to make a lot of use. I think it's important that those kids have somebody, and it can be easily not a full-time teacher, but somebody to get them started on the math from the books and go through that. And they get a little more individual drive to do that. Some of them have nobody at home to help them with it. So I kind of like having them in what we call then a study hall type of thing with a apprentice teacher.
Yeah, thank you for that, Kathy. I think, and I do think it's going to be all hands on deck as we support kids in small learning pods. And we'll have some ideas about that, I think, next week for you with the January 19th guidance as it comes out. We're hoping that they reduce some of the restrictions around limited in person, so we could do some more of that small group learning even with high school students as well. But we need them to relax some of the restrictions for limited in person right now. Right now, it's only 2 hours a day, and teachers can only see 5 groups of kids a week. So they can only work with 5 small groups in an entire week, and it's hard to plan a schedule like that. So, but that's a great idea.
Vice Chair Bethel.
So I appreciate that you called out the challenge with communication, because we know that that's a constant struggle in our district, is really getting the messaging out to all of our parents and students and staff and all the things. But I'd like more information. It doesn't need to be here on specifically what you're after in your student voice reach. And then also in the community feedback part of it. And I'd like to know what the timeline of that is, because I'm concerned that, you know, the governor said to the world in her Christmas gift that school's coming back, yay, and hopefully by February 15th, which was really, in my opinion, an insult to districts across the state who have a significant lift in front of them to get kids back. But getting kids back is really important. And I'd hate to have these particular concepts delay that process. So if somebody could help me understand that, that would be great. And it doesn't have to be here, but just so you know. The second thing is at the work session next week, I think it would be prudent to really talk about the transportation piece and the challenge that presents to the school district. And also, I've suggested that my kids specifically ride the bus, but we would be happy to opt out and offer their seats to other students. And I think there's other parents in the district that potentially could participate in that if that's something that could be figured out. And then I'm a bit concerned about the bullet point of the substitute shortage without real insight as to what that means. And so if next week in the work session you could address that, that would be helpful. Also, the bullet point for Ethan's spreadsheet that said, excuse me, his PowerPoint, it says in the spring for secondary, but then he said later in the spring. I'd like that to be defined. And then also there really needs to be some communication for our community around the cohorts for arts. We have really not heard from the district as to what that means. And we're hearing from a lot of parents who are struggling and frustrated with their kiddos who are in orchestra and things of that nature. So if we can talk about that too, potentially at the work session, that would be ideal.
So Director Bethel, I just want to make sure I captured or you could send me an email too.
Yeah.
I would be happy to, I wrote it all down. I will.
Just take a
wanted
picture
it in
and
the
send
record
it
as
to
well.
me. I just want to make sure we got all of that for next
Okay,
week.
Director Leopold has a question, and then I just want to throw something you can even answer in the next board meeting. Go ahead, Director Leopold.
Yeah, I mean, I think that it's important for us, to all acknowledge that while we all have our own, personal opinions, thoughts, and beliefs on how we're on the restrictions and how we're reopen, and things like that, I think it's important for us to also recognize that this isn't just a decision about us as individuals. For example, I'm young, healthy, and I live alone. So the scenario for me is much different than, a kid who lives with grandma and grandpa, or like a teacher, who's in the at-risk category. And so with that, I mean, I have two questions. The first one is, have we had any conversations yet? Because this is affecting our teachers and other people. And I don't think it's right for us to push our own personal beliefs onto others. And so I think my first question is, have we had any contact or communication with this with our teachers union? If so, well, how has that been? Or just teachers in general, you know? And then also like parents of students and things like that. How is that? Have we had any communication with the public or other people, and how has it gone so far? And then my second question is, how are we using the equity lens to guide this process to ensure that we're doing it in an equitable way?
So let me just jump in there on teachers. Yes, we have from the day before Christmas we started, but that's part of why SKEA is doing those educator forums, and those aren't just for union members, just hosting teachers for that. And then with the public, we've done just this little bit of communication. We're starting tonight, and then we'll push out this video from the board meeting and then figure out the other community events. What's hard is, and I think Director Bethel hit on this a little bit, is if we ask parents, if I'm the parent, I'm going to say I want my kids in school 5 days a week in the way we left off in March. So we can't ask that question. So it's a little bit about educating around what we can and can't do, which that was our first step tonight. And then we'll bring in a little bit more on the equity lens. We're thinking deeply on our elementary kids about when we bring in just a grade level or two at a time, which we have to do, there's an impact on a family, and that disproportionately impacts families that are living in poverty, kids that are, you know, so there's this push and pull of the equity work in this. We believe that every child reading by third grade is an equitable act. So we want to, that's why we're starting with the younger grades. And then we're using our limited in-person strategies at the secondary to really hit that equity question. So one of the, I just had a email with Principal Schoper this week around our refugee students who I've been particularly worried about, just with all the political unrest from their own country as they come to our country and what they're seeing in our own news. But his immediate answer to me was, yep, we're listening to them, and that's why we also brought them back in limited in person. So there's some of those examples like that, but we'll try to give a few more examples next week as well.
Okay, I just have two quick questions. You don't even have to answer it today. You can probably bring it up. First question is about mental health. You know, a lot of our, including seniors, are struggling emotionally, mental health wise, depression, and you know, thoughts of suicide, you know, and because all the attachment has gone overnight and they can't even keep in touch. I'm very worried about that. So I know you're going to bring them in batches. Is there any way we can provide some extra outreach or support, or that is one piece? Because that age group is very high risk group. The second piece is when I looked at your data dashboard, the Sparks, the Pacific Islander group is among the high school. They have the highest attendance drop. And then it kind of goes down. It almost reflects the pre-COVID inequities that you saw, right? So what are some of the steps that we can put in place for overcoming the learning loss? Because they're all in high school. It's not just about extra credit, but learning loss per se in case they go to college or whatever it is. So maybe you can please address this maybe next board meeting out of, you know, these are complex questions. You don't have to answer now.
We'll put both of them on our list for next week.
Thank you.
And I would just related specifically to the mental health reports, Dr. Chandragiri, remember next week is an update on our socio-emotional and behavioral health supports in the district. So we could build some of that in possibly. Please. What's that look like during COVID and our response as well. So thank you for both of those ideas.